Good evening, everyone. On behalf of QAI, I Aishwarya Shaji welcome you all to the awareness webinar on QAI accreditation standards for stroke center and advanced stroke center. Agenda of today's webinar is to talk about QAI, Introduction to CAHSC and its programs, Stroke Center and Advanced Stroke Center accreditation standards, QAI and accreditation process, a step-by-step guide, and a question-answer session. Hello, am I audible? I'm sorry for the inconvenience. So the accreditation programs that we offer are for hospitals, heart IVF centers, vision center, dental, ambulatory care, home care, patient safety WHO PSFH, department, emergency departments, clinics, stroke centers, dialysis units, telehealth, BMT, transition care, headache clinic, green healthcare facility, medical transport organization, hair transplant, and hotel and home stays. QAI is the first accreditation body in India to achieve ISQUA EEA accreditation in less than 5 years of operation. And it's also the first and only accreditation body in India having two standards accredited by ISQUA. QAI accreditation is also recognized by the Ministry of Health's Central Government Health Scheme, CGHS, for empanelment of private hospitals, eye centers, dental centers, and imaging centers. QAI is also the institutional member of the International Society for Quality in Healthcare, ISQA. This is the accreditation mark of QAI. Now coming to the main part, accreditation standards for stroke center and advanced stroke center. The following are the accreditation process of CAHSC. First part is the self-assessment that is done by the healthcare facility itself. Then is the application, self-assessment tool, documents, and fees that are provided by the organization to QAI. Then we review, register, and acknowledge the application and review the document. There is an optional pre-assessment, which can be on-site, remote, or in hybrid mode. Then an actual on-site, remote, or hybrid assessment is done. And the report reviewing, including scoring and non-compliance, is done. If the organization meet the score requirements, it is seen, and then we submit a corrective action for non-compliance. Then review by accreditation committee is done, which includes validating scores and accepting of corrective actions, after which the accreditation certificate is issued, which has a validity of 3 years. And various surveillance is conducted within 15 to 18 months of accreditation, which can be on-site, remote, or hybrid. And renewal of application is done by the organization 6 months before the expiry. Benefits of accreditation. From the point of view of patients, accreditation provides enhanced safety and trust, which assures that procedures from stem cell collection to infusion are conducted under stringent safety protocols. Availability of qualified professionals so that the care is delivered by trained and competent staff with verified credentials. There will be transparency and rights, thus providing informed consent, ethical safeguards, and patient rights are upheld at every stage. There would be continuity of care as patient benefits from a well-defined clinical pathway, including pre-assessment, transplant, and follow-up, thus resulting in better outcomes as evidence-based practice reduce complications and improve clinical results. For healthcare facilities, accreditation enables the HCF in demonstrating commitment to deliver quality and safe patient care. Accreditation assures community about the quality of services and better health outcomes. Accreditation helps demonstrating that healthcare facility functions in transparent and ethical manner. It also acts as a potential mechanism of risk management to safeguard provider from potential legal liability. It is a process to stimulate continual improvement and act as a mechanism of self-regulation. It may improve opportunity for benchmarking by comparing the outcomes with other accredited healthcare facilities. From the point of view of staff and healthcare facilities, accreditation process provides opportunity to staff at all levels for their professional development. It may help in building higher staff satisfaction because of good working environment, leadership opportunities, and ownership of process. Being robust in documentation and procedures in place, it also supports staff in building their confidence to deliver proper care. For third parties, accreditation provides an objective system for evaluation and empanelment by third parties like insurance companies, other pairs, and government, etc. Accreditation helps in access to reliable and documented information on facilities, infrastructure, services, and level of care. Objective of these standards are it provides a framework for quality assurance and quality improvement. It focuses on patient safety and quality of patient care. Accreditation sets standards for quality and safety that organizations must achieve. To be revised periodically and raise the bar, and it is used to achieve international recognition. Accreditation standards for primary stroke center and advanced stroke center has 10 chapters, 64 standards, and 280 criteria. QAI provides following accreditation programs for stroke care: Stroke Center Accreditation and Advanced Stroke Center Accreditation. These stroke care centers may be in the following healthcare settings: academic or teaching hospitals, district or public hospitals, private or corporate hospitals, standalone stroke centers. The following image shows the accreditation standards. It has 10 chapters and 64 standards and 280 criteria. Governance and Leadership GAL, the first chapter, has 4 standards and 17 criteria. Human Resource Management has 8 standards and 28 criteria. Facility and Risk Management has 5 standards and 16 criteria. Information Management System has 5 standards and 19 criteria. Continual Quality Improvement have 3 standards and 19 criteria. Patient Assessment and Care have 15 standards and 82 criteria. Patient Rights and Education have 5 standards and 26 criteria. Medication Management and Safety has 8 standards and 23 criteria. Surgical Care and Safety has 3 standards and 13 criteria. Hygiene and Infection Control have 8 standards and 37 criteria, concluding 64 standards and 280 criteria for 10 chapters. Accreditation standards frameworks include chapters followed by standards, which usually have various criteria under it. The first chapter is governance and leadership. Each center requires a governance structure that is ultimately responsible for the quality and safety of services provided. This responsibility is derived from its legal identity and operational authority for all activities undertaken by the center within the ambit of applicable laws and regulations. Each center, regardless of its complexity, also has a formal structure. Leaders ensure that a system exists that promotes safety and quality, provision of services that meet the needs of the patient, availability of adequate resources like human, financial, and physical, and monitoring and evaluation of improvement activities. The next chapter is human resource management. Human resource include all the people that work in, for, or with the center, and they are integral in ensuring the delivery of quality, patient-centered, and safe care. The center must be able to assure the public or patients that it can meet their needs and deliver quality and safe care through a team of dedicated and qualified staff. The support includes the management team, providing a safe physical environment for staff to work in, which is free from harassment or accidents. The third chapter is facility and risk management. The center will prevent people from receiving unsafe care and treatment and prevent avoidable harm or risk of harm. Safe, high quality care and support is intrinsically linked to how resources are used, including how they are planned, managed, and delivered. Center must assess the risks to people's health and safety during any care of treatment and make sure staff has the skills, experience, and competence to keep patients safe. Premises and equipment must be safe and available in sufficient quantities. Good clinical and good laboratory practices are followed in all its operations. Center must prevent the spread of any kind of infections. The next is information management system. An effective information management system is based on the information needs of the center. The system should be able to capture, transmit, store, analyze, utilize, and retrieve information as and when required for improving clinical outcomes, as well as individual and overall performance of the center. Information can be in any form, paper, electronic, or a mix of both. Continual quality improvement. Quality improvement recognizes that the safety of the patient is paramount. A center that is focused on quality improvement continually looks for ways to promote patient safety and quality of care. Quality and safety improvements in healthcare include a patient safety improvement program that requires healthcare providers to proactively identify risk and to plan, implement and evaluate necessary changes to improve the quality and safety of services. The center ensures regular evaluation of these programs through performance indicators and benchmark to identify both positive outcomes and areas for improvement. Any necessary actions to improve the quality and safety of the services are implemented and learning is disseminated both internally and externally. Patient assessment and care. Patient is in the center of the care being provided in a center. It is therefore important that the patient's rights are documented and known to patients. It is also important to provide education to patients related to their care. Better patient satisfaction or outcome is achieved when patients are adequately informed about their care, their rights are respected, and they are involved in the decision-making process. Patient rights and education. Patient is the center of the care being provided. It is therefore important that patient rights are documented and known to patients. It is also important to provide education to patients related to their care. Better patient satisfaction or outcome is achieved when patients are adequately informed about their care, their rights are respected, and they are involved in the decision-making process. Medication management and safety. The purpose of medication management is to provide a framework for safe and effective medication management system. Safe and effective medication management includes the process for procurement, storage, prescribing, transcribing, preparing, dispensing, and administration. All process of medication management of the center comply with rules and regulations of the law of the land. Surgical care and safety. It is important that the center has adequate space and knowledge to carry out various procedures which are current and based on evidence as far as possible. Different policies and procedures are required to be in place to ensure that procedures being performed provide desired outcomes and care is safe. Surgical procedures adhere to best practices for use of anesthesia, use of blood, and blood components. Patient safety is an integral component of care. Hygiene and infection control. Changing technology and disease profile continue to present new challenges for infection prevention and control within the center. Patients are at risk of developing healthcare-associated infections because of decreased immunity among patients. the increasing variety of medical procedures and invasive techniques, creating potential routes of infection, and the transmission of drug resistant bacteria among crowded populations, with poor infection control practices. Healthcare associated infections are among the most common complications affecting patients. Now, our valued clients of QAI include Lalita Super Speciality Hospital, Guntur, Max Hospital, Parparganj, Senthil Multi Speciality Hospital, Erode, Dr. Vanchilingam Hospital, Tanjavur, Baby Memorial Hospital, Calicut, Dr. Ramesh Cardiac and Multi Speciality Hospital, Guntur, Mazumdar Shaw Medical Center, Bengaluru, Apollo BGS Hospital, Mysore, Mitra Hospital, Calicut, Polo Hospitals International Limited, Ahmedabad, Zydus Hospital and Healthcare Research Private Limited, Ahmedabad, First Neuro Brain and Spine Super Speciality, Mangalore, CIMS Hospital Private Limited, Ahmedabad, Krishna Institute of Medical Science Limited, Secunderabad, KIMS Trivandrum, Calcutta Medical Research Institute, Kolkata, Wokharad Hospitals Limited, Thane, KIMS Al Shifa Healthcare Private Limited, Kerala, NM Virani Wokhad Hospital, Rajkot, J. Kuppuswamy Naidu Memorial Hospital, Coimbatore, KMC Specialty Hospitals Limited, Tiruchirappalli, Sri Ramakrishna Hospital, Coimbatore, Wokharad Hospitals Limited, Nagpur and Mumbai, Christian Medical College, Ranipet, Paras Hospital, Gurgaon, KG Hospital, Coimbatore, Fortis Hospital, Shalimar Bagh, Shalby Hospital Limited, Ahmedabad, Avitis Hospital, Palakkad, Ruby Hall Clinic Hospitals, Pune, Maharashtra, Ashoka Medicover, Nashik, and Lata Super Speciality Hospital, a division of KLMM Hospital Private Limited, Vijayawada. It also includes Tirupur Medical Foundation Private Limited, Tirupur, Lifeline Hospital and Research Center, Azamgarh, UMED Super Speciality Hospital, Palakkad, Valuvanad Hospital, Palakkad, and Shayadri Narayana Multi Speciality Hospital, Shimoga, Karnataka. QAI also provide various support services such as training on accreditation standards, on DIVE, that is documentation, implementation, verification and elevation program, which is designed to help staff in understanding of standards and its implementation and verification through internal audits or self-assessment. The last is SSA training. Thank you so much for your participation. For further query, you can contact QAI via www.qai.org.in or info@qai.org.in. Thank you so much. If you have any questions, please feel free to ask, or you can put your questions on the comment box so that we can review and answer you back. Thank you.
If anyone has any questions regarding the BT or any other stuff for the stroke accreditation, please feel free to ask. The recording is available on our YouTube. As for now, the PPT cannot be shared with the participants, but the participation certificate will be provided to you soon. If anyone has any questions, please feel free to ask. Mr. Amit, Dr. Priyanka, I hope the session was insightful to you.
Yes, it was very fruitful.
Sorry, I did not get you, Dr. Priyanka.
Yeah, the session was very fruitful. I think the PPT, I think somebody also asked in the chat box. If they
Actually, we
want to
cannot
share.
provide you the PPT, but the recording for the session is available on our YouTube channel. You would just visit it anytime, or you would just look at our Instagram for the video link.
Okay, thank you.
If anyone has any questions regarding anything for the accreditation standards, for the other webinars that we are going to be holding soon, please feel free to ask.
So one thing I have a question, like if we can know the timeline of this stroke accreditation program, like when do we apply and within what time is the assessment and when do we get accredited, all these things. Like, something is there. I think I missed the initial portion. If it was short.
Sure, ma'am. Actually, we have an accreditation cycle of 217 days. So, we usually get the queries from the hospital on a mail ID, that is the info ID, and we provide them with an application package that consists of the application form, SAD, that is a self-assessment toolkit that the hospital does a self-assessment based on the criteria, and there are several terms and conditions, the fee structure and all. And once the hospital has done it and the application form is filled, the hospital has to maintain the standards of the QAI for 2 months. And after the 2 months, they can apply for the with the application form, and they'll be providing us with all the documents. And the QA secretariat will be contacting the hospital or the person in contact with, asking for the rates. Once the rates are given and assessment is done, the hospital has to provide the NC closures if any found. And once the NCs are all cleared, it is taken to an AC committee. And once the committee is approving the hospital with and all the NCs are cleared, the hospital is accredited. So normally we have a cycle of 217 days, but sometimes it's also a 60-day cycle if all the process goes smooth. For now, we have even provided the accreditation in 40 days. So if you have any query for the stroke center accreditation, you can just contact us at this mail ID and we'll be providing you with all the necessary documents. Or you can just visit our website at qai.org.in. Anyone else have any doubt? We're also having an HCT webinar soon, so I hope I could see the same faces in that webinar as well. We'll be hoping that everyone could attend that webinar as well. It's a very informative webinar. We have just launched our HCT standards. If there is no questions now, we could just end the webinar. Thank you, everyone.
Thank you.
Thank you.